like I said, if you understand normal, then you can understand, well, let's eliminate some of this stuff. And that causes diseases. So that's kind of what I want you to do for all these systems that we have to do for pathophysiology. We should have an understanding of that. You know, a basic understanding to deal with the diseases. Because now we're going to be dealing with everything I've just dealt with now. Okay? Questions? Okay. So let's talk about bone diseases. Okay. Let's first talk about bone material. What is a bone made out of? Right? Basically, if you look at it, it's all those different things, but it's really cut down into two things. Either organic stuff or inorganic stuff. Things that are with proteins and have carbon in it, and then stuff that are non-carbon. So we can either have organic substances, which is basically the cells and collagen, and we can also have inorganic stuff, which is all the minerals, calcium, phosphate, sodium, potassium, all that stuff. All right? So if you understand this, then what happens if we remove one of them? What will that person, how is that person going to present to you? Okay. This is what will happen. Your normal bone has collagen and minerals. If we remove the minerals, then the bone is not going to be so hard. It'll bend. And you could actually do this little experiment. Show your kids this or your parents. This is neat. You take after you go to KFC, take the chicken bone and put it in vinegar, acetic acid. Put it in there, submerge it for about 3 days or so, and then take it out. What happens is the acetic acid in the vinegar reacts with the calcium in the bone and pulls out the calcium. And you'll see this, this fluff that's going to precipitate out floating on the vinegar. That's basically the precipitate of the reaction between the acetic acid and the calcium. We won't go into that. But take the bone out, it'll do this, because there's no calcium in there. Okay? So in a person who's got this, where there's not much minerals, think what's going to happen to my legs. All this weight is now on my bones and my legs. What's going to happen to my bones and my legs? They're going to, right? They're going to bend. Bow leg or knock knee, right? To deal with all that weight. If we remove the collagen, now the bones are more like glass. They're going to shatter. So the collagen is really making the, take a bowl, right? A Tupperware bowl, a plastic bowl. When you make that drop, it's not going to shatter. The synthetic substance that's in there is the collagen, so to say, and it's going to allow you to drop it. It's not going to crack or anything. You take a bowl that's glass and you drop that. See the difference? So you need both. You need the strength from the minerals, and you need the idea that it's a little bit flexible, that it's not going to shatter from the collagen. Make sense? We're talking about two diseases here. You've heard of Rickets? Rickets is soft bones because there's no calcium in the bones. There's a decreased amount. Okay? Now, it's a lack of vitamin D or a lack of calcium in the diet. We don't see this in America. This is more in third world countries because calcium's in milk, it's in cereal, it's in all the foods that you eat. Okay? But third world countries, unfortunately, they're not as privileged as us, right? We do have osteomalacia. Osteomalacia is the same thing as rickets, except in adults. We don't call rickets. You just don't say, you know, a 45-year-old man has rickets. That doesn't make any sense. So we say osteomalacia. All right. Osteo meaning bone, malacia meaning softening of. So these bones are soft. We don't usually see the reason. In the adult form, it's either a decrease in calcium in the diet. We don't usually see that as a reason here. But we do see that the GI system, right? The gastrointestinal. For some reason, it's not absorbing the calcium. So there's some kind of malabsorption going on. So we see that a little bit more, and we'll get into those when we get into the GI system. So they get skeleton deformities. They get the bowed legs, the knock knees. They get lordosis. Lordosis is what you got kyphosis, which is hunchback. You got scoliosis, and you got lordosis, where the lumbar curvature is more exaggerated. I'll show you pictures of this. All right. So you get low calcium, you get bone pain, all that pressure on your bones. Dental problems. Your teeth are in your jaws, but your jaws are getting very soft, so the teeth are falling out. Okay? Muscle weaknesses, fractures, especially green stick fractures, which we'll talk about fractures a little bit later. Okay? So they get this, right? The knock knees, the bowed legs. You see that. It makes sense. And this is the scoliosis, kyphosis, and lordosis. Lordosis, they walk around like this. It's just exaggerated over here. The way to help you remember these two things, well, lordosis, I just think, oh, Lord. You know, and that helps me to remember that. Right? Oh, Lord, right? You don't say, oh, Lord. So that helps you to decipher between lordosis. But hunchback is kyphosis. Okay? And that's what it really looks like in life, right? Okay, so what happens if we remove the collagen? Your bones turn to glass. Well, not glass, but glass-like. This is osteogenesis imperfecta, okay? It's also known as brittle bone disease. They just fall down the stairs, and kids are very resilient. These kids over here will actually break all their bones. Well, not all the bones, but they will have a lot of fractures. Okay? Now, it's a genetic disorder where either the collagen is defective or there's no collagen being made. And there's a lot of different types of collagen, so I don't want to go into it. But there are about 8 different types for the osteogenesis imperfecta. Collagen is all over the place, not just in the bones. It's in the eyes. So we have collagen that's in the eyes, and when it gets really thin, like there's not much collagen at the exterior portion of the eye, well, inside the eye is dark. So you have this thinning that's happening at the front of the eye, and that's allowing you to see inside the eye, and their sclera is not white anymore. The whites of your eye, they're more of a gray color or a bluish color. I'll show you what that looks like. That's usually classic. Okay? They get fractures, of course, loose joints, same thing with dental problems, teeth falling out, a hearing loss because it's also dealing with the bones in your ears too. Okay? Respiratory problems because the lungs do have collagen. If there's less collagen there, you can have some respiratory problems. See the sclera, how it's like a bluish color? All right? It's great. If I see a person who has this, and I know, my next question is, you know, in the past year, did you break any bones in your body? Yeah, how did you know? I can see it in your eyes.
That's creepy.
See what I mean? Now, don't get me wrong. This could just be that they're born this way, that the eyes have that blue color. All right? But it would be wrong to say, hey, look, someone is breaking a lot of fractures and you see the bluish in the eyes. Put one and one together. That it's probably related to the same disease. All right? And this kid here from Malcolm in the middle, or whatever that's called, right? He has osteogenesis imperfecta. What's that? Yeah, he's a cute kid. Well, he's not a kid anymore. Was he 18, 20 years old now? I don't know. But yeah, if you look back on Wikipedia and you see what he has all these fractures as he has. That's what he has. All right? So, I know it's kind of a crazy thing, but this is the kind of stuff that, you know, you're visually oriented. So if you have to draw pictures or you need to do something, if you remember this picture and all the different things about this, That picture will help you on an exam. You know, I mean, if you can visualize that, okay? Also, has anybody seen this movie? Unbreakable? That's what this was all about. Samuel L. Jackson plays a person with osteogenic imperfecta, and his name was Mr. Glass. But that was the whole thing, is that his bones were like glass, and he had broke every bone in his body. Okay, so you know, it's an old movie, but anyway, it's once you have time, I guess after this semester, you know, rent it or whichever. All right, so basically, I just want to show you how I'm going about doing this. Now, I just want to do an overview of bone and joint diseases, what we're going to be talking about in the next couple days, all right? We'll break it down into this. Metabolic bone disorders. We'll talk about Paget's disease, osteopenia and osteoporosis, and Rickets and Osteomalacia. We already talked about this, but I wanted to show you that if you know the normal, how to know about diseases. But I want you to also see, you can also break it up by this, like metabolic diseases, congenital bone deformities, or disorders, right? Dwarfism we'll talk about, osteopetrosis. We just talked about osteogenesis imperfecta, okay? We'll be then talking about some infectious diseases and bone neoplasia, like bone cancers, joint disorders, where we'll spend time talking about osteoarthritis and also rheumatoid arthritis and gout. And then we'll finish it off with fractures. That's just bone, and then we got to do muscle. But muscle's much smaller. We talk about muscular dystrophy and something called a myasthenia gravis. So there's only like 2 diseases there. So bone is much more we'll do. All right. So first, let's talk about the metabolic bone disorders. Okay. Paget's disease, also called osteoitis deformitis. Okay. Now, I don't want you to get mixed up. There is another disease called Paget's disease. Paget's disease of the breast. Really, it's Paget's disease of the skin, but the breast is mostly affected by it. That is a totally separate entity than what this is. So a lot of people get mixed up. So I'll be using Paget's disease of bone, using the of bone, so you don't get mixed up with the breast version. Okay? But they are two totally different diseases. All right. So Paget's disease. Well, we don't know the cause of it. We're guessing, as we're learning more and more, we're guessing there must be some viral component, but we haven't pinpointed it yet. We're still not sure what causes this. Now, 3% of people in the United States who are over 40 have this. We also know that there's some kind of environmental component. People in Europe just don't get this as often. People in Australia, a lot more. In the United States, we see about 3% over 40 years old. We don't usually... The way they find this is an incidental finding. They get an X-ray for some other thing, and then incidentally, they find out they have Paget's disease. So it's difficult. Most of them are asymptomatic, meaning like they have no symptoms. Okay? So how does this happen? All right. Something's going to increase the osteoclast activity. If it's this virus that causes it, that's what's going to cause it. But we don't know what actually stimulates it right now. We're guessing viral, but they can't figure out, they can't pinpoint which one. So this is what's going to happen. It's going to increase osteoclast activity. So is that going to put more holes in your bones, or is it going to put more bulk to your bones? Holes, right? So now look what's going to happen. You're going to have osteoclast activity happening so much more rapidly. So that means the osteoblast activity, which isn't anything wrong with it, has to work overtime. And it starts getting messy. So as soon as you get all this osteoclast activity, the osteoblasts are going to pour calcium in there, and it kind of spills over, and these bones don't really smooth out. There's bumps, and it gets really dense. Because the amount of osteoclast activity is happening, the osteoblast activity is trying to equaling it, and it's getting messy. It can't keep up with it. Because it takes some time for bone to form. You can break up, you have a fracture, we'll talk about these. It takes 6 to 8 weeks for that to happen, or to fix it. So what happens is the bones become very thick, they get dense, they get irregular in shape, because the osteoblast activity is so abnormal. It doesn't know where to put it. It goes all over the place. Eventually, the bone gets sclerosed, meaning scarred. And then no more activity happens, and it's irreversible. I'm going to show you what happens with that. So this is the skull. So you're taking like a skull cap, and you're looking in it. Right? So that's the top of the skull, inside. Notice the wall of the skull itself, how thick it is. And it's not smooth. So it indents over here, and it goes thicker. See what I mean? That's what's happening. Okay? This is what a normal bone looks like. Here's a bone with Paget's disease. See how it becomes very irregular and dense. Okay? We even have a situation like this. This is a severe case when the skull gets involved. It doesn't happen that fast over here, but it can happen. This is called litiasis osseo, which basically means lying face, because the face looks very big. Look at the way the skull is. You can't fix that. It gets irregular, it just fills in. All right?
Couldn't you do plastic surgery?
That's what you're going to have to do with that. You're going to have to cut in and destroy, you know.
But you have to, like, literally remove bones.
Yeah. So it's more of a cosmetic thing over here. Well, they'll end up doing something that's palliative. They want to make sure that they can eat. That they don't want this to close up. You can't breathe. So they're going to make it, cosmetic stuff is more of secondary. We need to make sure the person's going to live. You got to make sure you're eating, got to make sure you're breathing. Right? And then
Can it grow back after you remove it?
Paget's disease is hard to fix. So it's hard to treat and cure. So it'll just grow right back. So, okay? So common bones that are affected is usually the femur, the pelvis, the skull, and the vertebrae. Okay? Like I said, the symptoms on here is usually asymptomatic, which means they usually have no symptoms until later on. Hearing abnormalities, because the bones in the ears start getting affected, numbness in the arms and legs, pain, bending of the long bones, all right? Diagnosis, like I said, it's usually incidental, because they're doing an x-ray of something else for something, you know, for other reasons. We also know that the alkaline phosphatase, which is an enzyme, it ends with ASD, it's an enzyme. This is an enzyme that comes out of osteoblasts. And because the osteoblast activity is so great, their blood levels of alkaline phosphatase go up. So if they do an incidental finding on, if they find an incidental finding on, or something that looks, that warrants further evaluation, they do an X-ray and they see something not right there. The next thing they want to do is do a blood level of alkaline phosphatase. If this is high and this is Paget, okay? So complications, get fractures, osteoarthritis, heart failure, because the heart has to work extra time, hearing loss because the bone's in there. The big thing that we're concerned about is that 1% of these patients develop osteosarcoma, cancer. So this is why it's important to pick up Paget's disease early on. Let's face it, 1% is very low, but I don't care. If you're the one that has Paget's, you want it to be 0% that it's going to be cancer, not even 1%. So we got to find those and see what we can do with that, all right? So the treatment for this is what we call bisphosphonates. You've seen bisphosphonates. You've heard about them. You just didn't know they were called bisphosphonates. If you watch commercials on TV, I know Sally Field does one called Boniva. Boniva is bisphosphonates. And what does it do? It's going to decrease osteoclast activity. They use Boniva for osteoporosis, which is an increased amount of osteoclast activity. Makes your bones become styrofoam, right? So if we could give you a medication that's going to slow down the osteoclast activity, there you go. Bisphosphonates. Fosfomax is another one, all right?